All right. Hello. Good morning, everybody. We do have many people on attending our webinar this morning. My name is Kathy Doubleday. I'm Doctor of Physical Therapy, and we are here to talk about bone health. And I am joined by my friend and colleague, Kaitlin Ryan. And Dr. Ryan is coming from Wisconsin today. So opposite climate as we are here in California. You're going to be seeing Kaitlin a lot more on our webcasts and our videos in the future. So we thank you. Kaitlin practices in the field home health and physical therapy in Wisconsin. So welcome, Kaitlin.
Thank you for having me.
Yeah, good. Thanks for being here. We're going to just talk about the things that we feel passionate about in bone density. And the reason it's so important is that it is an issue that can cause some pretty substantial medical problems, but it's silent in the uptick or the problems that are occurring. So you may not know it until there's a big issue. So this is why we need to let people know that they need to take this seriously as early as possible, and that it's never too late to do something about building up your bone density by doing our exercises and doing things that we know are helpful for building our bones. We're going to go over more specifics about how that works and why we can prevent things. But we want to talk about the difference in costs to you, the cost to you financially, but also in your function and your overall health. It's dramatically different, right? So if we keep up with our exercises and things that are going to help our bones, then it prevents us from having catastrophic changes. And Kaitlin, you work in the home health industry. What have you seen that's affected people's function due to things like bone density?
Sure. I mean, some of the most common, I would say, for fractures that I see is anything in the back, lots of times a compression fracture, thoracic level or lumbar level. The other is the fracture of the femur, right where your hip joint is. So they'll call it a hip fracture. Those are the two probably most common. They can be very painful, very difficult to recover from. Sometimes, people don't even recover back to their baseline function, especially with a hip fracture. It really impacts their independence. And I think, it's very costly, especially because you go to the hospital. Sometimes there's an ambulance ride, then there's rehab afterwards, and then you're coming home after that. So there's lots of therapy afterwards as well.
So, I mean, it's not meant to be a scare tactic, but a little bit, we just want to bring it to your attention that we're talking about fractures and we're talking about postural deformities that are unchangeable and problematic. And that if we attend to some of these things early and as often as possible, we can make a big difference. There's a really amazing statistic that talks about, where's my sheet? Yes, that 67% of fractures are potentially preventable. All right, so this is a lot of fractures, and it means that we need to pay attention to it and work towards trying to prevent them. The costs of taking care of our bones are what? The cost of exercise, which is a little bit of possibly some financial investment in classes, courses, gym memberships, access to things that can help you get more exercise and more loading. Maybe some supplements, right? We might have to take a little bit more. We might need to pay for some screenings, but we need to screen our bones to see how are we doing? Is there improvement happening? If we're going to do an intervention, it's good to see before and after, and a test for bone density is the way to do it. So that's a very common thing. And those screenings start, in your 60s usually, but even sometimes they start earlier, like during menopause. They might even take a look at your bones to see what level you're at there. And that will determine whether you're at more risk as you lose bone. So those are some of the costs, which are much, much less than the costs that Kaitlin talked about in terms of what happens when we do actually get a fracture. And there's great medical care, and with diligence and work and therapy and attention to things, you can recover, right, Kaitlin? A lot of people do recover. They do get back to function. So if you had a fracture, or if you end up having a fracture, it's not the end of the world. You just have a lot of things to get in the row to get you back to your function. So we're talking about prevention. Okay. Kaitlin, talk to me a little bit about our bones and how they function. Like, what's going on that makes it preventable?
Sure. So, I mean, our bone is constantly growing and it's constantly breaking down. So, for the prevention part of it, we're obviously trying to keep our bones strong. And in order to keep them strong, part of that is the exercise. Part of it is hormone changes, and some, naturally that's occurring, but we'll talk a little bit more about some things that can be doing to either prevent or retain bone mass. With that breaking down and kind of what's going on with the bones, the forces that we're putting on our bones, those help our bones grow in certain areas. So there's specific exercises or things that can be done to kind of strengthen your bones and help them be strengthened in the right way. I like to use the analogy for skin. You're working or you're exercising, or let's say you're using a hammer or a shovel. Eventually, if you keep using that, your skin is going to form a callus. It's getting stronger in the area that you're putting force and need to be building up that strength in the skin. Same thing for bone. You got to be specific. If you are putting a certain load on the bone is going to start growing specific to those areas. So we can be doing things that can give us specific strength depending on what it is that we're looking for. So bone is constantly adapting. It takes a long time. I think, 1 to 2 years for a bone to kind of go off and then be fully recovered. Is that right?
Yeah. So what we're saying is that there is a constant turnover of bone, and our peak bone mass, the top of our bone density, is around 30 years old. And then from there, it starts to decline slowly. And then when women hit menopause, it drops like dramatically. So it's something for us to be looking for, and not just later, like earlier. So the earlier we intervene, say if in our 50s, that's why we always include 50-year-olds in our discussions, is that we really want people to know that the earlier we intervene, the better, right? So with men, it's a little bit different. So men's drop in testosterone, their major hormone, comes later in life. So in their 70s, and women, it's in our 50s. So we have to deal with this a lot sooner than men. So we want to make sure that we are working on that. And that callus formation, I think that's just a great, it's a great perspective that helps people understand that if you use your bones, let's take astronauts for an example. If astronauts, they go up in space, when they're in space for a while, they're in an anti-gravity situation. What they found is the longer they were up, now we were starting to leave people up in space for a long time. It's essential that we do something to load their bones, because if not, they come back with such weak bones that they can hardly stand up, and they are much more risk for fracture. So we can think about that. What's the opposite of that? Is like, okay, we live here on Earth with gravity, but we need to give it bone loading forces. So we need to give it that load that will help you build it. Okay, so you can think, anti-astronaut, load the bone, use gravity, make gravity work for us. Instead of us always thinking gravity's bad, right? It's pulling everything down. It's pulling our posture down. It's pulling our skin down. We're thinking about it as like, okay, we're going to use gravity now in this way. We want to use gravity to hit the ground with some challenge, with some force and challenge that gives a vibration up through the bone, and it stimulates that bone to lay down more bone. Because that balance, like Kaitlin was saying, like the buildup and the breakdown, if the breakdown is faster than the buildup, then we get a negative, we get a decline, we get a negative angle of bone loss. And if we add more force, we build up the bone building and we have enough nutrients, those things, it levels it out. So at least we try to not lose bone. If we really work hard, we can build our bones too. All right, good. That's a great sort of viewpoint for you guys to understand that there's an essential way and that you can do something that helps to stimulate that. What are some other risk factors, Kaitlin, that make people more susceptible, that maybe you should be more aware of your bone density issues and try to work on it?
Sure. So family history is a big piece of that. I mean, my mom, she has osteopenia, so I'm more concerned for myself, and I'm trying to be preventative and more cognizant of, what I'm eating and drinking and doing in order to either delay or prevent that from happening to me. I think you're about 1.5 times more likely to develop osteoporosis if a family member has it. Another big one is smoking and alcohol intake. Smoking increases about 1.3%. Excessive alcohol intake, I should say, is about 1.4%. I do see this pretty frequently with home health visits and patients that I see. A lot of them are smokers, a lot of them are alcohol drinkers. So I try to educate them. Basically, once they've had a fracture, in order to help with the healing process, you really want to try and decrease what you're intaking for those. And unfortunately, if you have a fracture, you're twice as likely to have another fracture. So if it's happened to you, the chances of it happening again is more likely than if it's never happened.
Yeah, we do see that. And that once you have a fracture, people may get another fracture. Definitely in the spine too, right? So the spinal fractures, having one fracture then puts more stress on the surrounding vertebrae, and there can be an additional fracture. So really working on those techniques and movements that help to prevent the motions that put excessive loads on those parts of your spine are really helpful. And we'll get into some of that in just a minute. So now we know that it's important. And I'm hoping you're building a picture in your mind that we need to do something for this prevention, right? These are preventable things. We want to try to address it. We just want everybody to know that they have things that they can do. So what do we do with this information? What are we going to do? Well, one of them, being physical therapists, top on our list, is exercise. Okay. So exercise, and like I said, using gravity for good. All right. We're going to use gravity to do things that load our bones. So exercise that loads your bones. A lot of them people do, right? So walking is one of them. Tennis, climbing stairs, hiking, where you're going uphill, where you're giving yourself, loads, going uphill, going downhill, right? Going downhill, you're hitting the ground with a little bit more force. I always try to do that in the shower. I don't know why. It's the shower. I have this concrete shower with tile, and my husband goes, "What are you doing in there?" I'm stomping on the ground. I just push my heels. I just stomp my feet on the ground. That's like one of my little things that I do on a daily basis. So finding ways of incorporating this gravity load through your day. Kaitlin, are there any types of exercises that you've used for people? I know you're working with people who've had fractures, so you're not loading bones like that, but
Correct,
maybe,
yeah.
right?
Yeah, I'm still early on in the recovery process. So I'm still working a lot more on the functional stuff that you talked about with the walking. Even, going from sitting to standing, just the bone or the muscles and how they can kind of add a little tension to the bone, that still puts on a load to the bone in itself. So just using the muscles can help with that bone and kind of forming, like I said, that callus. just with the muscles itself. But, I don't have access to this, but like a leg press is something that could be done. But, we use that as almost a sitting to standing exercise, just in and out of a chair, working the same muscles, putting pretty similar load on. It's just using gravity in the body with that. Obviously, with all these exercises, trying to maintain a neutral spine. I had a patient recently that already had a vertebral fracture for their thoracic spine, and they were doing almost like this resisted crunch motion, and it wasn't good because it's just putting their back into kind of that rounded position, and we want to really maintain this position with all of the exercises that we're doing.
So one exercise is that bone loading, and then the other one is resistance exercise, right? So that's what Kate was talking about, like getting something where you have to push against it or pull against it. There's a lot of ways to get that. And at home, it's sit to stand, it's carrying your groceries, it's doing your work around the house, it's maybe climbing some stairs, maybe repeatedly doing a step up and using your glute muscles. And then in therapy and exercise classes, we try to use some bands, right? We can use elastic bands. And then there's machines, right? Going to a gym and using machines that you can do free weights or machine work that loads your bones. And it's progressive, right? Kaitlin, you don't just start with
Correct.
a heavy weight to get started.
Exactly. You want to start really low. So for a lot of my patients, we'll start with just body and, gravity resistance, starting there. And then you're going to add in those resistance bands. And resistance bands, they come in all sorts of resistances. So we always start with the lighter bands, and depending on the brand that you use, different colors mean different things. So we just try and progress them through there with the resistance bands, progressing how long they're walking. We're not going to start off at a marathon miles or anything like that. Sometimes it's just going around the house to start yourself off with. If you're washing dishes, that's somewhere that you can be doing that, or standing on one leg,
like
just
that
doing a little bit extra. Yeah, and incorporating these exercises into your day, I think, is just much more realistic from a preventative standpoint than some people. It's really hard to give that dedicated time. Some people it's great and that's what works for them, but some people they'd rather incorporate it throughout their day. And in addition to the resistance, the balance exercises, standing on one leg to wash the dishes if you're able to do that. Otherwise, just standing near your sink with your countertop kind of as a little steady surface for you to be on. There is a progression that you can go to, just like you were talking about, where we start off with maybe there's 2 feet on the ground and we're standing still, and then progressing towards single leg stances, or mobile, where you are kind of walking a tightrope or even sidestepping along your counters. Those are balance exercises that I think are super easy to do at home, that you can incorporate either into your day or just a little bit of a routine. 10, 15 to 20 minutes in a day is really would be great for the balance.
Yeah. So like recommendations for this exercise, right? So we have weight bearing exercise, and we're trying to get like 30 minutes. So this would be walking or hiking or some kind of sports play. Pickleball is very popular out here. I don't know if it is there, but 3 or 4 times a week is the recommendation that you do some kind of physical activity, and walking is probably one of those things that if you haven't started, that's probably a good place to start in terms of loading. And you can also do the bone loading stuff, right? We talked about. And then resistance training 2 to 3 times a week for 20, 30 minutes of different variety of exercises, your legs, your arms, your trunk, combined motions, band exercises, like doing resistance a couple times a week, 2 or 3 times a week. And then balance, right? Kaitlin said balance exercises. Those need to be done 10, 15, maybe 20 minutes a couple times a week at least. Okay. So you can add in all 3 of these components as often as you can, but you're trying to exercise 4 days a week at least. And I just wanted to quick say, doing water aerobics, swimming, and even bicycling, which I used to think was a great muscular demand kind of exercise, but people who cycle a lot still get osteoporosis. So having, all your exercise be in the pool is not a good idea. So you need to supplement. We don't live in the water, so we have to have the gravity, right? That's an anti-gravity situation. And it may allow you to exercise a lot more when you have arthritis, definitely. But we have to find some ways to load our bones in the gravity situation, okay? So we need to make sure we do that. It's just not enough to cycle and to swim. We need to do more bone loading. And that's where we have an ebook. I wanted to let you guys know we have a free ebook. All you have to do in the questions and answers is put in the ebook. Just put in ebook, and we will send you this free book, which has like 5, home exercises that you can do, plus a few sort of things that we just talked about, like just gives you recommendations for some exercise to help build your bones. So you can put that in the questions and answers and just put ebook and we'll send you that. All right. So we have another way to prevent is giving supplements and using good nutrition, right? So there's 2 main things. There's a lot of also micronutrients that people, tout as important, but calcium and vitamin D are the most essential components for helping you build the bone. Those are components that help you build the bone up. What are some things that you recommend, Kaitlin, for getting those supplements?
Sure. I mean, in my experience, or what I would be doing if I am unable to get those amount of nutrients in my diet, so I'm trying to eat leafy greens, I'm trying to drink plenty of milk that's got the vitamin D in it already. I drink a glass of that a night now because I'm trying to prevent this from happening. Now that I'm over 30, my bone bank is it's near its max, so I'm just trying to maintain as best I can. Having the fish, and I think I said the milk already, those things I think are super important that I'm trying to stay on top of and make sure I'm putting into my body. And if I'm unable to kind of meet those demands, I think we have it here. I'm a little bit younger for these, but the women 51 plus, you're trying to, I think you said, split it up into a couple of times a day where you're equaling about 1,200 milligrams of the calcium. And then, if you're not able to get it with your nutrition, that's where your supplements help out. They're called supplements for a reason. It's to supplement whatever your diet's not covering. So those are some things that I try and focus on. I know you're currently going through trying some stuff out for yourself, right?
Yeah. So I've always been told, and the research shows that more than 500 or 600 milligrams we can't absorb at any one time. So to split that 1,200 into 2 doses throughout the day is helpful. So I always try to do supplementation of calcium twice a day and vitamin D once a day. And that's an easy one that we can test with a blood test. So your doctor will probably let you know how much vitamin D you need to take, because if you're a male, if you're a man and you have enough vitamin D, you probably shouldn't be taking supplements. There's some other problems that can occur with that, with the prostate. So you want to make sure that you're getting a blood test before you just randomly start taking a large dose of vitamin D. So that's something you can find out, and your doctor can help you figure that out, how much you should take. But yeah, they can take 1,000 to 2,000 units of vitamin D if you are someone who is at risk or has a low blood level of vitamin D. I also wanted to just talk about, there's new analysis of old data that hormone treatments, estrogen replacement is much safer than we originally thought. And I think that it's something to bring up. It's FDA approved to use estrogen to support your bones. So hormone therapy is something that is going to be on the rise because it does not cause cancer. It can increase the growth of a current breast cancer, but it does not cause breast cancer. And many, many women of all ages can tolerate and get the benefits of estrogen replacement therapy. So it's something to talk to your doctor about. There is much more. Not everybody has that opinion yet, but there's growing evidence, and there's growing evidence of doctors who feel this way, that we don't have to just deal with these losses. And bone density is one of those really big losses. The risk of fracture, the risk of losing your function because of fractures is essential, is astronomical, and the statistics on recovery from them that we went over already is just really dramatic. So nearly 50% of people who have a fracture don't become independent. They don't make it back to their original level. So it's essential that we stay active. And if you are exercising and you're strong and then you have a fracture, you are much more likely, I think, right, Kaitlin, to recover from that fracture. So even if you do get a fracture, having this regimen in your life, in your plan for what you're doing for your health is so essential, and it makes a really big difference.
Yeah, absolutely.
Yeah.
Yeah, it's better to go in strong. They say the same thing for a surgery. You go in strong, they call it, prehab, and you're doing that stuff before you have your surgery, you're coming out stronger. So the stronger you can be, and what is it, reducing, I think 35 to 45% by doing balance and strength and resistance training can be helpful in reducing your risk of fracture. So if you can do things to prevent that fracture from happening, or if you can do things that make your bones stronger so that, let's say you do end up having a fracture, you're just going to come out a lot stronger than if you didn't do those things.
Yeah, the numbers on like exercise and vitamin D supplementation, they've done this in nursing facilities. I mean, we're talking about the people who have the least capacity for movement, just giving them supplements and then adding exercise on top of that. It reduces the risk of fracture 54%. I mean, there aren't medications that do these kind of numbers. I mean, this is really dramatic. It's really important for everybody to make sure that they're working on some kind of bone loading exercise, resistance training, balance, getting your gravity to help you. So we have a lot of resources. Okay. I want to just talk to you about resources. How are we doing on time? We're good. The National Osteoporosis Foundation has a wonderful website that has a lot of these types of statistics that we've talked about. And I want to promote local exercise programs. It's so much better. It's always good to exercise at home. And that's like maybe easier to do on a very daily basis. But finding a place in your neighborhood that does exercise classes designed for people at your level, whatever that is, where you can challenge yourself, you can get new things going all the time, and you can stay motivated. You can go see your friends. You can be, interactive. I know that happens in so many places. It's like find your community where you can be supported. And that makes a huge difference in you continuing to do these exercise routines that can help your bones, because it's never too late to start. That's like one of those really big things, right? It's never too late to start. This turnover is happening for our entire life. You never lose the ability to build strength, to build bone density, to improve your balance, right? There's neurologic reasons why we might lose our balance. There's physiologic reasons. There's age-related changes, but balance and falling is not part of normal aging. Right, Kaitlin?
Right. That is, I mean, from day one since I've ever met you, that's been a big thing, because everyone's like, oh, I'm getting old, I'm going to fall. It's just, you're adamant. You've always been that way. Falling is not a normal part of aging. And there's things that you can do to prevent those falls. And that's, what we're doing here.
It's a sign that something's not going well, right? And everyone can have a fall, and you can even have a fracture, but you will be more resilient to return to your prior function if you are working on these things. So local exercise programs, your calcium-rich food list. You can find those on the internet. What can you not find on the internet? But, food that is helpful for, building your bones list, so that you can figure out what kind of cabbage is better or which kind of leafy green is better than another, and find the things that, if you don't like kale, you can find something else that works for you. Arugula. That's mine. And then also just home safety, right? That's something that you deal with as well, Kaitlin, going to someone's home, is like making sure that there aren't things that are going to, cause you to have falls while you're at home.
Correct. Yep. Yeah. Rugs are a big thing. I tell every patient, either get rid of them or tape them down. Some of them, they refuse to get rid of them. It's their rug. They like it. That's fine. Just tape it down so that when you're walking over it, or if, you're using a walker, that it doesn't pick up at that edge and cause a fall.
Yeah, that happens so often. It's like you always have to be looking, where's your walker? What is it doing? What is it pulling up? In all of these, stomping the ground and dropping the heels and lifting weights, you always want to be in a tall posture. You always want to make sure that your abdominal muscles and your trunk muscles are holding and helping support you, so that you don't get the load that, causes pain in your back, or, to round over when you're doing the load, right? You don't want to lift, like Kaitlin said, you don't want to do any forward flexion. There's a lot of specifics about movements that we want to, make sure that we, cover. We do have a resource. We also want to make sure that about our OsteoFit program. We actually have a workshop. There's a workshop called OsteoFit, and it is a combination of a whole lot of data and information and a really detailed plan. So OsteoFit is on our website, physioed.com. And you can look at under workshops, and you can find it there. And we will also put a link in our Facebook group. If you're not already a member of that, it's under Facebook, and it's called Successful Aging 50 Plus. And you can become a member there. So that's another place that you'll be able to find our information. Okay. So this is a very important topic of prevention and health that physical therapists feel very strongly about. You can always use your resources of your physical therapist in your town, right? Kaitlin, you guys have a little bit of a different system in Wisconsin, but here in California and a lot of states, there are a lot of like independently practicing therapists that may have programs, right? Exercise programs. You guys might have a community center. We have a community center here in Ojai that has free classes for seniors, and then more dynamic classes at our place at Balance in Ojai. And look at your communities and find places for you to be involved. Kaitlin, is there anything else you wanted to share with us? We thank you so much for being part of this with us. We're really excited to get you on camera and help us out in the future as well.
Absolutely. I think you did a good job covering everything. And as long as no one has any other questions, I don't have any questions.
So this is the beginning. This is our first webinar, and there will be a series of webinars in the next 6 weeks. So probably every 2 weeks. We'll have a variety of presenters, but Kaitlin will be with us in probably 2 weeks doing more specifics on balance. And so we can talk a little bit more specifically about balance and the types of movements that you want to avoid if you have bone density problems, and just to prevent having fractures. So that's going to be in a couple weeks, and the OsteoFit program is going to be available during this season, during this series of exercises. So We want you to feel like you get a lot of information. And then if you feel like you like this topic and you feel like it's an important topic for you, then you can have this whole workshop as well. So that's like just an additional thing. But we're going to give you a couple more free webinars. So look for our email and our notifications on the upcoming webinars that you can be a part of. We are going to see you next time in probably 2 weeks. Thursday mornings are our time that Kaitlin and I match up, and that is going to probably be the best time for both of us. So look for us Thursday mornings, and we'll talk to you next time. Thank you so much, Kaitlin. We'll see you soon.
Thank you.